The Learning Disability Mortality Review Programme is the first national programme of its kind and is really important because it's fundamentally about improving lives of people with a learning disability, improving quality of care and standards of care across the whole system. It will provide us with an opportunity to really understand what it is that's causing these premature deaths of people with a learning disability, and then being very clear about what we need to do to stop that from happening. So what are we learning from the reviews that were being carried out that we can then turn into action of improvement to improve the lives for people with a learning disability across Cumbria and the North East. One of the improvement work streams that the network is leading on is about dysphagia. And that's directly in result to what we are learning from reviews. So the reviews are showing us that there's a higher than anticipated number of people who are dying from aspiration pneumonia. And we want to understand that in a lot of detail as to why that is, and then what are we going to do about it. Now we're in a much stronger position because we are actually using the learning from the reviews and turning that into improvement action.
People with a learning disability are at risk of dying 27 years earlier than everyone else.
Most of these deaths can be prevented if we get the right support and care that we need.
Watch this video to find out how.
Don't let us die too young.
When completing a review, my advice would be to be thorough. Do not take a sentence or a paragraph or a report at face value. Dig a little deeper, find out a bit more information till you've got a full understanding of the situation. Explore all opportunities and all area of notes and interactions with family members and other MDT professionals.
If you're asked to be part of a LeDeR review, don't be scared about it. These processes are not around blaming somebody or trying to point the finger at someone. They're really about learning what actually happened. So we all sit down together in a room and we all talk about the person, what we knew about the person, what happened during their life, and how we can learn from things and improve to make services better. If you are asked to attend a LeDeR review, there's loads of information out there that can help you. There's leaflets that you can take away and look at, including easy read leaflets. Make sure you're comfortable before you go into the meeting, but really use it as a learning opportunity to improve our services and put in place those actions for people with learning disabilities.
It's an opportunity to learn from experiences that clients have had and improve services going forward to ensure that we're offering the best possible care to clients.
We will commit to learn from these deaths and to improve our services and to make things better for people with learning disabilities.
People with a learning disability are at risk of dying 27 years earlier than everyone else.
Many of these deaths can be prevented if the support and care needed is provided.
As a senior leader,
as a community learning disability nurse,
you can help us live longer and healthier lives.
Don't let us die too young.
Often we sadly lose people who don't have any family members or advocates that are actively involved in their support. So sometimes they do disappear into the ether when they've sadly passed away. So it's so important that we look at what the support people have had, how the services around them have provided that support to them, and that they've had a good experience through the care sector. So this is why the LeDeR programme is so important, to really shine a spotlight on the experiences that people have and to make sure that people do have positive memories and they are receiving the right care and support from all parties involved.
I've received an email just to say that we'd had a person who had died and they just wanted to review the process in doing that. As an organisation, we hadn't been through the LeDeR process before. We went to the review and it was actually a very positive experience. One of the big take-back points for us was there was a lot of talk about the funding, for example, and we'd perhaps lost that human element to it. That there was an individual at the end of this who needed support. From there we were asked to do a presentation, and then we've tried to implement it within our organisation as well to make sure that each death does get reviewed and that we're delivering the right support to each individual.
From participation in the LeDeR review, We now focus our services on providing lifelong holistic and positive support to make sure that people don't die too young, to make sure that they live rich and fulfilled lives and that they access all of the services that are available to them effectively and productively.
Within the review that we had, there was lots of feedback, positive feedback for the staff team. I think particularly when there has been a death, it's important that the staff get that part of it as well, that they had done a lot right, but also understand where things could have been improved, that they get that learning, again, to try and prevent it from happening in the future.
People with a learning disability are at risk of dying 27 years earlier than anyone else.
Many of these deaths can be prevented if we get the support and care we need.
As a social care provider,
As a social worker,
you can help us live longer and healthier lives. Don't let us die too young.
Having been to the Don't Let Me Die Too Young conference, it really made me think about what we can do as hospital nurses and community nurses to make sure that people with learning disabilities have the same opportunities for health and care that everyone else gets with no barriers put in their way. So from that conference, I got some people together who are working on learning disabilities to sort of think about what we can do to make that experience much better and improve the outcomes for people with learning disabilities.
The true measure of any society can be found in how it treats its most vulnerable individuals. This is a quote by Mahatma Gandhi, and it still holds true today, especially with people with learning disabilities. As a medical director of a large foundation trust, I've instigated the Learning from Deaths policy. As part of that policy, any patient with learning disabilities who sadly dies is subject to a mortality review. From this review, we hope to learn where we have gone wrong and give people with learning disabilities the same opportunity as anyone else in society.
People with a learning disability are at risk of dying 27 years earlier than everyone else.
Many of these deaths can be prevented if we get the support and care we need.
As a GP,
As a hospital nurse,
As a hospital doctor, you can help us to live longer and healthier lives.
don't let us die too young.